404-622-4444 and ask your medical questions because your health is important. And now, Doctors Marlon B. Jackson and Millard J. Collier.
Look out, peeps on WYZE, telling you about the hip-hop doc posse. Dr. M.J. Collier, I'm your family physician. Please allow me a moment to dedicate my mission. The original hip-hop doc, don't you deny it. Check out my curriculum vitae, I can surely supply it. Trying to take my name, sir, don't even try it. I've been curing ills for years before you even died it. Live in the studios, WYZE. Tune in and dial up if you have a question for me. I can understand why you tried to be me. A hip-hop doc is the bomb and the best as far as the eye can see. I'll be keeping it real, making it plain, keeping you healthy, free of pain. Discussing topics, real no jive, putting it down to keep you alive. I don't mean to brag or even boast. I am your medical doctor and your radio host. I am the original hip-hop doc.
That sounds sweet. Say it again.
I am the hip-hop doc.
One more time.
The original hip-hop doc.
That's right.
I'll be keeping it real, making it plain, keeping you healthy, free of pain. Discussing topics, real no jive, putting it down to keep you alive. I don't mean to brag or even boast. I am your medical doctor and your radio host. The original hip-hop doc. I am the hip-hop doc. The original hip-hop doc. And good afternoon and welcome to this edition of the Your Health is Important radio broadcast, the only interactive healthcare forum that allows you, the listener, to call in and ask your healthcare questions. We are live in the studios of 1480 WYZE. Big Donald Cochran is screening your calls, and we want to hear from you. I am Dr. M.J. Collier, your family physician, along with
Dr. Marlon Jackson. Flow as you go. Control. You know, I got to know. We do this, and we have been doing this for over 25 years. For those of you who don't recognize, that is the longest health broadcast. It's almost coming up to the longest broadcast on any medium. And we are proud of that fact, and we are still strong, continuing to take it long, because your health is important. Keeping it real and making it plain, keeping you healthy, free of pain, because Dr. Marlon Jackson is here
to bequeath a set of $1 million Hollywood teeth.
I was just going to say I'm here, and I'm here with my medical aid team partner, the original hip-hop doc, who pulls no stops when it comes time to resolving medical conditions and saving a life. Because when it comes to your health, don't even think twice about making a choice. Do I live or do I get this new car? Do I eat all these high cholesterol foods when I'm overweight? Or do I try to exercise and eat the right thing or take the right supplements? You know, there is no choice. So that's why we say your health is important. And you know, plenty of people try to equate your health and wealth. There's one connection. Your health is your wealth.
That's it. Without it.
Speaking of wealth and speaking of events, we had a fantastic health fair for the men. There were a few women there, but, you know, Dr. Jackson contributed. Dr. M.J. Collier was teaching. He was making sure everything was in place. Thank you, Dr. Bennett. He continues to take care of those men. We appreciate that, doctor, and we appreciate all the other doctors. We even had an oral surgeon come in there. If Dr. Dillon, Tracy Dillon is listening, thank you so much. We send him a lot of business from Southside and from Auburn Dental. Dr. Jackson, when I can't pull a tooth, or I think, and that's very rare, that's like 1 or 2% out of 100. But when I think you need an oral surgeon, that's one of the fine gentlemen I sent. But like I said, that was a great health fair, Dr. Collier, and I really appreciate participating, but we don't hang our head on our laurels. We keep it moving. And where are we moving to?
We're moving to Saturday, October the 14th at the Galleria at South DeKalb Mall, located right at I-20 and Candler Road. We're on the east side of town, and we're going to be bringing to you the Ryan Cameron Foundation Health Fair. This one, we concentrate, of course, on cardiovascular disease. We also emphasize young people's health. So we're going to be doing absolutely free sports physicals on the young people so they can participate in the springtime sports. We also, of course, are going to be doing vision testing, hearing testing, dental exams, chiropractors evaluating the back and doing scoliosis screenings, and podiatrists evaluating the feet, because these young people now, they jamming their feet into these shoes, and boy, I'm really seeing some bad problems with those feet. So we're evaluating you from head to toe, and all at absolutely no cost. It's going to be a live remote radio broadcast from V103, the People Station. Come on out and meet the faces behind the microphones. Dr. M.J. Collier and Dr. Marlon B. Jackson will be hosting an Ask the Doctor segment. So you can come out, sit in the audience, meet and greet, handshake, take pictures, selfies, put it on your social media, get autographs, all those things brought to you at absolutely no cost as a community partnership with 1480 WYZE. Saturday, October the 14th. Put it on your calendar. There's going to be a 5K walk run Saturday morning at 8:30. The health fair will kick off promptly at 10 o'clock a.m. It will go from 10 to 2. So we want to see your face there. Come out and get yourself checked because your health is important. We're live in the studios. We want to hear what you have to say. 404-622-4444, 404-622-4444.
And I did appreciate the last broadcast with Miss Deborah Tendricks with Eat Better, Live Better. That's what we all need to do. We need to eat better so that we can live better. Because if we don't, first of all, you gain the weight, you may inherit diabetes, hypertension, joint problems in your knee, your hip. You could get a stent because the cholesterol, the plaque is occluding your heart vessels. A lot of things can happen if we don't eat better. We won't live too well. Okay, so that was a fantastic broadcast. I think when that young lady comes back in town, we have to get her back on.
Emphasizing childhood obesity, and let me tell you, she was absolutely incredible because her personal weight loss story was an adventure, and she was a refugee from the weather down in Florida. She came to Atlanta to escape the storms and ended up participating in the health fair and coming out and met that medical aid team.
That was her purpose.
That was her purpose.
And I think, let me see, if anybody wanted to know her website, I think it's eblb.org. eblb.org.
Eat better, live better.
Well, first of all, I guess we could spend a little time on a couple of things. One is, and I hope nothing happens tonight, but we may have dodged that health Obamacare repeal effort because that wasn't going to be no good for anybody. I'm going to tell you, there's a lot of things that are at risk, but two things that Dr. Jackson really am concerned about is that pre-existing condition, keeping or excluding that from health care coverage, and medical benefit maximums. No caps, no pre-existing conditions. If we don't have that, at least you'll have a fair plan, maybe. But if you have either one of those conditions, or if the Congress passes anything that eliminates health care maximums or put a cap on it, and pre-existing conditions, trust me, everybody, not just people who were on Obamacare, but everybody's insurance premiums will go up tremendously.
Absolutely. It's going to really, really have a devastating effect and has had a devastating effect. We already have had Blue Cross Blue Shield pull out of Georgia in the Affordable Care Act market. They still have private insurance plans through employers, but the Affordable Care Act marketplace, they have pulled out. And when you have fewer participants, you have less competition. You have less competition. You have higher prices. So, you are in a dilemma right now of trying to just stay on insurance somewhere with somebody. But also the prices have gone up exponentially now. So even though they were already high, they're going even higher. So it's going to be a big problem.
Right. And that's why we try to encourage you to eat better, live better. Like I said, get the proper exercise. Between myself and Dr. Collier, we can tune you into anti-aging methods and procedures and supplements that will not only help you lose weight, help you build muscle, help you feel better, help you with your joints, because that is what we want you to be tuned into, the anti-aging. And in the future, I'll be giving information about how you can contact me about that. But right now, the man with the plan with that is Dr. M.J. Collier. Can you give him a little bit of information on how to tune into your anti-aging?
Absolutely. You can go to my website, LipoDrops, LipoDrops.com. Go to LipoDrops.com, and you'll see Dr. Collier's recommended 3 for longevity. 3 for longevity. That's vitamin D you should take every day. Probiotics you should take every day. And omega-3 fish oil you should take every day. I take them every day. I just saw my doctor, had my blood work done. Literally every test was perfect. Thyroid function, cholesterol panel, CBC, comprehensive metabolic panel, didn't have a single abnormality, nor was anything even close to being abnormal. As a matter of fact, everything was either right in the middle or on the high side of optimization, which is where you want to be and which is where you can be. We can optimize you, and there are various reasons to take these products. For instance, vitamin D, which we recommended. It's a strong anti-inflammatory, but it has great benefits on the cellular level. So it prevents you from getting and protects you from breast cancer for ladies, prostate cancer for men, colon cancer for everybody else. And everybody
help you
that
stand
I
up
test,
straight.
Help
Don't
you stand
forget
up
about
straight.
that osteoporosis.
Absolutely. Strong bones, nice skin, nice hair, all those things. But we talking about, a whole higher level of health if we are cancer preventive. And, we do a lot of bad things, and there are a lot of bad things in the atmosphere that we're exposed to. And so some things you can't get away from. The number one cancer in men and women is lung cancer, even in people with no history of smoking. So lung cancer is number one. Prostate cancer is number 2 in men. Breast cancer is number 2 in women. Then colon cancer. And colon cancer is moving up with a bullet, which is why we want to take those probiotics. They really, really cause your immune system to become hyperactive, takes care of those abnormal cells, and prevents and helps you from getting the colon cancer. So, those three, take those 3 for longevity. That's what you want to do, and that will enhance your life. LipoDrops.com for further information. Dr. MBJ, there was something in the news that we got to talk about. Because they talk about it on the regular news when I was driving over here, the 12 o'clock news. City of Atlanta, decriminalizing marijuana. No longer jail time of 6 months and $1,000 plus fine. $75 like a speeding ticket, and that's it. Going about your business for possession of less than 1 ounce. What are your thoughts?
Well, first of all, anything that, from what I can gather as a physician, from a health perspective, let's just even say as a dentist, what heavy marijuana use does, it puts a coating, that oil, when you burn it, it coats your teeth. It makes you, if you don't take care of your teeth, it makes you have more conducive to periodontal disease. But it does not cause cavities, unlike crack cocaine or methamphetamine, which, I've seen people who have been in treatment, and I've taken care of their dental health, and they have, I can see fillings I've done that have already either been decayed or wiped out because of the caustic nature of the chemicals from, ingesting either, I guess, through smoking it or shooting it. It just causes a lot of problems. I have done some research on that. Now, there is 2 parts to marijuana. There's the cannabinoid version or the THC that gives you that high. Then there is the part, the sativa, that I think a lot of research is being done on that, because actually that part of the plant does not cause that psychoactive high feature, but it does things like seizure control. It helps people focus.
ADHD improvement.
Yes, a whole lot of things. So there's probably a lot of research that will be done with that. But the thing about it is, in terms of that, it will probably, allow the law enforcement to concentrate on more serious crimes, like armed robberies. We still have those robberies going on. Probably spend more time with domestic cases, because a lot of these shootings that we see are because of domestic events. I think that might be a good thing. The fine, well, the city has another way of getting income. So at least these people, if they get a fine, they can work it off versus being confined.
Well, right now, remember, they're paying $1,000 minimum, and oftentimes they'll pile on charges that may make that up to $2,000. So from that perspective, they're going to lose money. But they also probably won't hesitate to write fines, for people. But again, this is not medicinal. We're not having a conversation about medicinal per se, because we know the health benefits. This is strictly recreational use. People that want to have a good time, feel good.
Well, like I said, the part I'm concerned about, and it's not just that, but other avenues, is the law enforcement prison sentencing guidelines. Anything to lessen that, which will probably affect, I'm going to use Dr. Collier's word today, African American.
Disproportionately
right.
affected.
I'm all for, because, we can't be the worst in anything. Okay, so I think it's a step in the right direction. Looking at the experiment in Colorado, California, and Seattle on the recreational tip, they're making a lot of money.
They're making a whole lot
and
of
I'm
money.
sure some of it is going toward infrastructure, municipality improvements, and so forth. So that possibly can be a good thing. We just have to wait and see. 404-622-4444. What are your thoughts? Don't do it at all, or do it to death? We do have a call. Caller, you're live and on the air. Your health is important.
Hello.
Hello.
I'm calling because I was trying to find out about the health fair, and I just happened to walk into a room and the radio was on. So I'm kind of coming in on the tail end of the conversation. But,
Well, good. We can give you one. The health fair is Saturday, October the 14th.
and where is it going to be held at?
At the Galleria at South DeKalb Mall. That's at I-20 and Candler Road.
Okay, are they doing like carpooling from different communities?
No, there's no carbon. I mean, communities are free to organize their own, but they're not doing any other than broadcasting that it's there, it's free, people can come, it's free parking. But we have literally had, bus loads of people come from churches and other social organizations, but we are not responsible for organizing that.
Okay, I'm just calling, because I do live in Southeast Atlanta. My name is Annette, and there's a lot going on in the community concerning gentrification and eminent domain and a lot of other things that are going on.
Oh, absolutely. I was Martin Luther King, I talked about last time. I was just driving home. They are totally revitalizing all the way to Fulton Industrial Boulevard. They are repaving the streets, the projects that I grew up in as a kid.
Well, you know what? I can talk about gentrification. It's simple. First of all, what has happened is, I would say, the powers that be have allowed certain areas, they have a plan for them, crime, because not a lot of money is put there on law enforcement or business improvement, the values around them places go down. Crime comes in because there's no law enforcement.
Okay, you said law enforcement. I think that's been part of the problem.
No. Listen, let me finish.
Okay, I will.
It's not just law enforcement, but usually what makes a community work is you got to have what we call commerce centers. You have to have things like a bank, food, doctor's office, dental office, and supporting ancillary services to make a community work.
Correct.
And when they don't have that, there's no traffic. No traffic is where criminal elements like to go, and then they just tear the neighborhood down more and more until
Recreation besides recreation for those students at Georgia Tech and Georgia State. Remember the stadiums now. Remember, who did they build those stadiums for?
right.
But anyway, I know I got off a conversation.
Well, no, that's a good point, but I was trying to make a point. When there's gentrification, what it is the people that live there, either they can't afford to live there, either through taxes, or they can't pay their mortgage, so they either do quick claim deeds or they just outright lose it through foreclosure. And people come in and see a vision, or they get some inside information to get there and stay there.
Okay,
Well,
you're right.
when there's gentrification, if I'm gonna just call it like it is, if white folks are moving in and everybody there's this old outdated thought that where white folks go, then that's where the best thing is. Well, why don't we go ahead and move back into those areas too? That'll cure gentrification. There are real estate deals and so forth.
And I just want to say, since you are a gospel station, correct?
Yes.
Okay. Well, you know what? I attended a church located on Martin Street, but I had to step out of church because I got tired of playing dressed-up church, because I got tired of doing the same thing over and over again and hearing the same sermons, about doing this and doing that, things they preaching from out of the Bible when I walk out that door, and then I see things that are going on in the community, and most of the pastors, a lot of them don't even live in the communities and not a part of what's going on in the community. And I look at that as being part of the issue, too, especially if you're still teaching the same thing and you're not actively involved in trying to make something better, not even for some of your members. So,
you got...
Okay, I'm going to say this because, I called a big church, and I asked them, I said, tell me something about the widowers fund. Is there anything that would help a woman that doesn't have anybody to help her, a homeowner or something, if she would come into your church and ask you for some help, maybe with some plumbing or to fix a leaky roof or something like that, because we should have some people in church that know how to fix a leaky roof, know how to do plumbing, know how to do landscaping. These are the jobs, because every time I call somebody, most of the time it's a white person that comes there. And this is the problem, while most black people in church teaching about the Bible, then there's people out there training people, training their people to go in and make a business.
Well, first of all,
and I feel
you got excellent points. To me, this is probably, I'll say anybody that's probably 45 years and above, because we have probably been trained and educated, have vocations or professions, and we've done them for a while. We got to reach back and start getting younger people. We've got to. It's the baton handoff, and I think for the last two generations that has been poor at best for a description, and that's why these young folks, and plus don't forget about the internet and the globalization, where they can go online and they can be distracted, hypnotized into thinking that their whole lives are on there. Mm-hmm. But in reality, they should use that as an adjunct to what they need to be doing with the rest of their lives. So there hasn't been enough, and let's not forget, even though we're on a gospel station, yes, we have had hip-hop and the message and how all these things tend to distract our kids and make them think the regular classic vocations and professions, they're just square. And they're looking for something else when they need to know that, first of all, there's nothing new under the sun.
But I just want to tell you this, and I need to get off because it is in my telephone, but we all know that music is very powerful, right?
Right.
Because most of the people, and you got to admit it, you got to be honest, most of the people when they come to church, they come for the music, and that's no lie, because it is the music that moves people. Now, hip-hop is out there, too. And it's a lot of positive hip-hoppers out there, a lot of positive rappers out there. And the thing about it, what they're doing now, they're waking up a lot of those people that's been sleeping for so long, that's been playing up church. But anyway, I'm going to have to get off because it is with my telephone. Again, We could carry this conversation over and over again. But just like I said, I went into a church, several churches, and I dropped off that piece of paper about the Million Man March, about, what to do when you go back into your neighborhood, and how many of them actually came back. Not only, speaking about the Million Man March, how many preachers came back. And we know what's going on with a lot of the mega preachers, because I called the church and I said, you know what, I need some help. I need some help cutting down some trees in the backyard. And I know my potential.
Well,
many black men or able-bodied people can come out here and cut a tree down for somebody who happens to be a senior citizen for free.
Well, you've brought up some excellent points. Whatever we can't do as physical people, I believe in the power of prayer, okay? So I'm going to just leave it like that. If you want to change something, use your will that you have to help affect or change things. A lot of talking won't do. And we do have another call, and we enjoyed your comments. Keep listening here. Thank you. Caller, you're live and on the air. Your help is important.
I'm going to make it real brief because it's time for y'all to get off. But I want to thank you for Dr. J and Dr. Collier. I've lost 12 pounds. I'm the lady that's going to want to put in those leather pants for December.
Oh, you the one I saw you. You almost caused me to have a wreck from Mayhem, huh?
Like the truck driver.
Well, I appreciate that, and I know Dr. Collier does, but you keep up the good work.
Yes,
because if you do it right,
yes.
If you do it right, there won't be no rebound. But
That's right.
Once you go down that road, commit to it for the rest of your life.
Yes. And I want to make a comment about the marijuana, but what's going on now, they need to find the people that's selling, because that's why all the break-in is selling. The lady just got a purse snatched this morning at the grocery store. And they're getting money, they're pawning and getting people flat string beads, taking to the drug people to get drugs. The marijuana went up from from a nickel bag to a 10-cent a bag. And ever since then, we got all these people just breaking in and stealing. But that's what they're doing. They're taking to the drug people swap for drugs. And they need to sort of get the people that bringing it in, who were flying in from Colombia or Mexico, they get those people and stop it. But it's a big money racket going on. But we really need to get the theft stopped in Atlanta, and they need to start putting the people where they're from, where they're located from, because they're Georgia people not doing all this.
Yeah, I was going to say, the real reason I think we have a high crime problem is not so much the drugs, but Atlanta's growing. Atlanta's seen as an opportunity. In fact, it is the new Hollywood. And criminals see that. They recognize the money is there. Gangs see that. They come. I just remember back 10 years ago when they had 12 years ago when Hurricane Katrina, we had one level of crime, but after we inherited a bunch of those folks, the crime level went up.
So the Olympic went on too. We had a lot.
Right. So a lot of this is just from new people. We don't know who these people are. We don't have our sense of community to where we know, who are, let's just say, winos are, who are petty criminals are. There's a lot of these new people in, and they cause a lot of chaos and crime. So,
but Dr. Collier, excuse me, but they need to start going where they sleep at night, because they don't stay up all night. Crime committed around 2 or 3 in the morning. They just start locking the people whoever they live with, because they know they're bringing those merchandise in there and they're not working. They're stealing. So they start putting the people picture on the TV or put them in the newspaper or something where these people, the one that's stealing and doing all this crime, where they live at.
That's
they
right.
Locking the people up, and somebody would speak up.
Well, we're gonna have
identify those people doing that.
We're gonna have to probably have somebody who has a lot more expertise on that and get them on the show so we can discuss things like that. We've never really taken that on per se.
Well, get all those mayors, all the people. Seem like we got 100 people running for mayor of Atlanta. So how can you get those people to come on?
Good point. That's what.
And really, y'all don't need.
You know what? If
somebody
from mayor, if somebody's running for mayor now, cut that up, Big Don. This is important. Cut it out. I've done slash for cash. I'm here on the mic now trying to make it right. Anybody who's running for mayor candidate, I want you to start saying today, in terms of crime, I want you to say you want to make the streets safe enough for our elderly to walk and our women to walk 24 hours a day. If you can't do that, the job ain't done. Okay, that's what we have to do. We have to make the community safe for our elderly. And I'm going to let you take us off right there. So if you're a mayor and you want to get elected, start saying that.
All right, 9 candidates, and we talked about that. That brings to an end this very insightful episode of the Your Health is Important radio broadcast, brought to you every second and fourth Wednesdays at 1480 WYZE. Why, Dr. Jackson?
Because
Your health
is important.
We hope you've enjoyed today's conversation with Doctors Millard J. Collier and Marlon V. Jackson. For further information regarding medical information, contact family physician Dr. Millard J. Collier. Call 770-948-5400 for questions on how to make your smile the best part of you. Contact family dentist Dr. Marlon B. Jackson. Call 404-681-3834. Remember, the legend continues. Health care is a right, but good health is a blessing. Tune in every second and fourth Wednesday at 12:30 p.m. right here on WYZE, because your health is